Are you planning to quit clinical dentistry? Then imagine a course in which there is a guaranteed job after you finish that course. And you will earn more in the first 1 year in that job than you have invested in the course. Yes, IIHMR, along with Red Varsity, is coming up with an emergency medical services course. And to explain us more about it, today we have with us Dr. Tausif. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed. Dr. Tausif, it's amazing that finally we are face to face, though it's on Zoom, maybe someday personally. Uh, if anyone had to go through Dr. Tausif's biodata, they would understand he's given his whole and soul when it comes to pre-emergency care or emergency care. Dr. Tausif is the Chief Academic Officer at Red Varsity and the Chief Operating Officer and Medical Director at Red Hill. He is one of the India's first 50 trained emergency physicians and is also a member of the India-Nepal Board of Disaster Management. Not just this, he has many firsts. For example, he helped create the 20 plus bedded emergency unit at Sundaram Medical Foundation in Chennai. These were basically emergency rooms. At that time, regular rooms in other hospitals were just called casualty wards. He went on to build and launch multiple high quality programs for doctors, nurses, and paramedics over the years. It's not just the academic side. Clinically, in today's day and age, he manages 600 plus patients on every day. That's a daily basis as a part of his role in Red Health. But even after so much of clinical experience, his passion for teaching and guiding people in the field is what drives his initiative to continue managing all the academic programs at Red Varsity. Not just that, Red Varsity collaborates with various leading health universities to see that emergency care is no longer something which we just imagine, but which is easily available for the general public in today's day and age. So, Dr. Tausif, thank you for taking your time and joining us today.
Thank you, Dr. Satish, for a very kind introduction. Absolutely a pleasure to be here. Like you said, my entire life's been spent working on emergency medicine and pre-hospital care and disaster medicine. So whatever more I can do for it, more than happy to be a part of it. Thank you so much.
Great. See, I understand the background. You're interested in emergency care. You're inspired about it. You feel pre-hospital care courses should be done. Okay. But my question to you is, how is this course aligned with the current demands when it comes to India's healthcare? Not just India. Let's talk in the entire world terms and abroad, that is. Do you think such a course is absolutely relevant?
Absolutely. I mean, it's a perfect question to start off with and warm up the table. First and foremost, this kind of a course, do you know where it exists? It exists only in three major universities across the world: Harvard, Stanford, and University of Glasgow. Right? So big universities who know the importance of international fellowship in EMS. So what they do is their doctors finish their emergency medicine and then they go there. They go to different countries and learn about pre-hospital care and how they can improve upon it. We have brought that course to India. And why is this the right time for that course to come to India? Well, as you can see it, we are launching 10-minute ambulances along with your food grocery apps, right? Which means that people are now focusing on EMS, emergency medical services. We always think care is limited only to the four walls of a hospital. Why? Emergencies don't happen there, right? They happen at a scene, maybe at the roadside, maybe at somebody's office or workplace, could be somebody's home. What happens in that crucial golden hour? Somebody's got to take care of it. So that is why this course is highly relevant to India. It can bring in that global quality that we want to India, and we desperately need leaders who can take this forward. That is why this is the right term for this course, the right time for this course in India.
I'll just tell you a personal experience of mine. Around 15 years ago, my grandmother suffered from sleep apnea. Okay. And by the time we got her to the hospital, it was late. I don't know, maybe she had already passed away in her sleep and there was no use of emergency medicine at that time. But I remember it took me at least 15 minutes to even get connected to a person who would get me a emergency van at that point of time. So I think, yes, this is the need of the hour, and people are moving in that direction. If you want your groceries quick, don't you want your healthcare to be quicker when you're in an emergency? So absolutely agree with you, Dr. Tausif. It really makes sense that EMS is required in today's day and age. And with India developing, patients being able to pay, this is a growing field. But my question to you is, for whom is this course designed? Is it only for the MBBS graduates? Is it only for the people who are driving the vans? Does it make sense for dentists to get into this field?
Absolutely. I'll answer the dentist question a little later because, as you would know, half of India's administrative healthcare is run by dentists at this point of time, right? But yes, this course is designed for any healthcare professional, including dentists, and not only dentists, MBBS doctors, Ayush doctors, allied healthcare graduates. Who are allied healthcare graduates? Allied healthcare graduates are doing emergency medical technology, dialysis technology, physiotherapy, respiratory technology, any one of them, any healthcare graduate who is looking to lend their expertise or become a superstar leader in pre-hospital care. Now, this course is a very unique curriculum. It can unlock multiple career pathways for the student as per their own interests. For example, dentists who wish to take up non-clinical roles can be ready to get roles such as quality managers, operations managers, simulation trainers or instructors, business leaders they can become, or administrative managers if their sights are set on my chair to become the chief operating officer of a company. Well, all of these career options can be unlocked with this one course. And if you'd like to, I can explain it a little later down the discussion.
But before we even go further that, okay, what's the structure of the course? What am I taught? So you told me after I finish this course, I can do a lot of things. But what am I going to learn if I join this course?
Fantastic question. So this course is a super mix. It is a mix of not just clinical skills. It also gives you administrative skills. It also gives you operational skills that somebody, if in case they're interested in that, they can go in. It's 11-month course divided into 6 months of online training, which must sound the music to people's ears if they're already practicing and don't want to move there from their hometown. And then there is a 3 months of hands-on training in Bangalore at the IHMR University and 2 months of internship. So why is it designed like that? There's a lot of theory knowledge that goes in, which we hope that within 6 months of online training, we can train people on it. And the 3 months of hands-on training will give them key clinical skills because you can't be an operations leader for a pre-hospital care service if you don't know what clinical care is given inside that ambulance cabin. So we give 3 months of hands-on training, and then 2 months of internship allows you to, experience the real world. You go into an ambulance, you go to an operations system that's being used to manage these ambulances. You can look at how business leaders operate across this, look at all the administrative problems they have, and learn for yourself how this happens. So once you go through this structure, it enables people across India to access the program since they need to only come to Bangalore physically for 3 months compared to any other decent PG program, which requires 1 to 2 years of physical training. So we're trying to make it easy for people not just to get this course done at their own convenience, but also make sure that they get all the relevant skills in this course, be it clinical, managerial, administrative, business, anything. We would like to help cover those training aspects so that they can be smart enough to run the whole EMS service by themselves.
Great. So you're trying to even find competitors for Red Health.
There are no competitors, they're only collaborators, Dr. Satish. Yes, the more, the merrier.
Great. That's how it is. You have to grow the field along with it because then only people will be aware that this is a service which they ideally require. It's well put. I understood the course. The advantage is basically I can do some part of it sitting at home. The part which I really can learn on my own. Why should I come out there, waste my time, spend money, stay there? Second, of course, I want the clinical hands-on. I want to come there. I want to see what actually happens. I just want to read a book basically. But my point to you is, what clinical skills I'm learning? You had mentioned clinical skills along with business, administration, and management. So, a dentist, what clinical skills he would learn once he's there? Before you listen to the answer to that question, remember the guest has taken out time from his busy schedule to come and help you. So, do not forget to hit the like button below. And do you want to take your career to the next level after BDS? Then I'm sure you're already subscribed to the Kaizen Dental.
Well, first and foremost, you need to know all the life-saving life support courses, which is basic life support, advanced trauma life support. We'll also give you training on managing different system emergencies. While you may be comfortable with head and neck emergencies, we also will teach you cardiac emergencies, neurological emergencies, respiratory, genitourinary emergencies. So all emergencies could be pediatric or gynec related or elderly. And these are the common emergencies that we look at. So we will give a clinical look into all of these emergencies. We will, on that, in that 3 months of hands-on training, we'll try and teach you as many bedside hand skills as possible that you may be able to learn so that you become confident. And let's say you become a chief paramedic officer or a chief quality officer, if that's your bent of mind, then you should have paramedics that you can assess properly. They shouldn't be able to tell you, you don't know, I know what I'm doing, right? So you should be able to say, no, no, I know what you're doing. I am equally trained in that. I can oversee the quality of the care that you're delivering. And that's why we have tailored it with all these clinical skills that are there. But of course, on top of that, we'll also, like I previously mentioned, layer some operational skills and administrative and business skills also on top of that.
Understood. So, what in detail would I learn about management skills? You think once I finish this course, I would be able to manage people as such? First thing. Second, does this course have actually real time emergency care and emergency room exposure? Or I'm only just going to see what happens behind the
No,
scene?
no, no, no. So the last 2 months, you will be in real-time emergency care. So, Red Health operates a fantastic assistance center situated out of Hyderabad. We have a great tech team that is sitting in Bangalore. So, and then you can not just experience how calls are answered and assigned, how we choose the nearest ambulance. We can also see how the tech works around it. There's an entire platform software on which we layer all our ambulances. And as soon as somebody calls in, the nearest ambulance gets picked up, right? So the people who are going through this course will get to learn how this particular system works. And then they can see how we make sure that our ambulances are people ready when somebody calls in, how we make sure those ambulances are there. We happen to be Asia's first JCI accredited medical transport system. So the advantage that you get is you learn to understand, so you also start to understand what clinical quality indicators JCI demands when you're running a medical transport system. So how are we maintaining those KPIs? How we ensure the right training is delivered on the ground? All of this will come to you. Plus, we have people who liaison with hospitals as well, right? So they talk to them, they make sure that they are comfortable giving us their ambulances and allowing us to run it and making sure we give the right care to their patients. So you also understand the business side of things and how you keep those relationships alive and how you can make sure that you get everyone across India, not just your patients, to trust you to let them run your ambulance service. So all of these exposures you will get. 2 months you will be on the field in the ambulance or the emergency department, and you will be experiencing all of this firsthand.
Great. So I'm going to get a perfect mix of how to run the management part of it, as well as understanding clinically what emergency care is all about. Great. But whenever we go to a course, okay, I always say, look at the faculty, whether they're teaching you, whether they're great mentors. Now we know your background, Dr. Tausif. You have a good mentor. You've been training people since ages. But it's not just one mentor which makes your entire course. So could you give us a background of the faculty members? Which university are you collaborating with? And if I'm doing this course, I'm sure I'll be confident that I will learn everything I'm out.
Well, of that, people can be rest assured. We are tying up with one of the best healthcare management universities in India. It's IHMR Bangalore, so Indian Institute of Healthcare Management and Research. A lot of dentists have come out through the doors of that university and become healthcare leaders across India. We find them fantastic. They are our go-to university for Red Health to go to when we want to hire business graduates with a healthcare background, and that's why we get them. So that was our automatic choice to tie up with to do this course. So first and foremost, IHMR, established brand, you're going to get faculty from there. So you can trust that faculty because they've already been training your peers and seniors and making them fantastic healthcare professionals. We come with industry experience. So all the faculty that is going to be provided by Red Health are going to be people who've been out there in the field. Our field trained faculty that you will get, they are when you come to life support case, a certificate yourself. So everything is validated, everything is clinically certified, and everything comes from real world experience. The faculty who are there, you can ask them, you can throw real world scenarios, like Dr. Satish was talking about how he had an experience with an emergency. You can just throw it out and say, I was walking on the street, this happened. Have you ever been in that situation before? And I'm sure the faculty will be more than happy to answer that from a real world point of view. So that's interesting experience and bring you certified faculty for the course.
Great. Okay. It is create the perfect given the code. How many mentorship if I join your course? So if I throw real questions, I'll get but career mentorship I'm asking about.
Right. So, couple of things. First, how many seats are available? I think Naman can answer that question better, but I think it's about 60 to start off with. The first batch, but depending on how many people apply, IHM will decide how many students per batch can be taken. So it's not just that, we are taking, oh, let's take as many students as they come. They know exactly what is a good batch size and how much can and be trained well, and then they will decide on that. That's the first question. Mentorship. Well, we are the industry that will absorb them, right? So it's not like we are going to train them, get them to do the course, and then, hey, go and find your own way in the world. That's not how it is. The reason Red Health has started Redversity and then gotten into pre-hospital care is because they want people, they want high quality people to come and work with them. There are many career pathways, and the course is built so that when a student finishes, irrespective of which one they choose, whether they choose a clinical pathway, they choose a quality pathway, administrator pathway, or a business pathway, rest assured there are people who are already existing in that system, practicing it on a daily basis, who will then become their mentors because it's in the mentor's best interest to have a great candidate come and work with them. So if you're a dentist, you have a junior dentist who's coming in, you're going to put your time and effort training that person because it makes life easier for you. And it makes sure that the quality of care that you deliver will be continued with the dentist who your healthcare works. So they don't have to worry about mentorship because we are doing it for our own self-interest in interest. So we really want to mentor people. All of these paths already exist and it's structured there in the organization already. They can get real world experience, training from experienced people or experts in the field and become high value in the pre-hospital care arena. That's what we can promise.
Great. So you are promising basic job placements. Okay. Could you share more about what type of job roles and job profiles these students would get into? You told about what they love basically, and what kind of salary packages, okay, or career growth can these students expect once they get into this field? Reason is how they used to have this ad saying, "ये गाड़ी के बारे में कितना देती है?" Okay. Anyone who does a course post dentistry, they want to know कितना मिल रहा है.
So this is one thing. So our interest is in growing this specialty, right? We want pre-hospital care. We want to build India's 911. That's Red Health's goal. Yes, and we want people to be there. So to encourage people, we have told them that we will give them guaranteed placements, right? At a starting salary of 6 lakhs per annum. That's the promise that Red Health is giving. And it's not an empty promise, and I'll tell you why. First, Red Health is present in 30 cities across country. Care, Kim's, Fortis, Apollo, Narayana, Medanta, Paras, they all work with us. They all trust us to run their ambulances. The aforementioned food grocery app, which delivers 10-minute ambulances, we run those ambulances.
Oh, wow.
That's the reality of things, right? So we are expanding this field, right? We are building this field across India. We need people here, and we can get these people employed at either with us or with any of these hospitals and other institutions that we work with, because all of them need operational leaders at different levels, right? So that is why we are able to confidently tell students that don't worry about jobs. We are guaranteeing job placements for you. We are guaranteeing your basic first year salary at 6 lakhs per annum, and then at the smartness and how well you shine and then growth is unlimited because we live in a startup world today. So there's not limited to your 10%, 15% growth anymore. So people can grow. It depends on how much initiative they show, right? So they can grow. Now, coming to the second part, well, kind of pathways they can take. So I previously mentioned, if you have a clinic of mind, you can become our clinical operations manager, wherein you say, hey, all paramedics are my baby. I will do the rostering. I will look after their training. I will look at the equipment and I will manage that. Or you can be on the other side of the fence. You can say, I'm the chief quality officer. Okay, which means what? The clinical operations manager sets everything. The chief quality officer checks, did you get everything right? So they audit you, they maintain the JCI KPIs, and then they can go there. So if that's your bent of mind, I want to work in the world of healthcare quality and patient safety, fantastic, that's for you. Then there is a third person who is our ambulance operations manager. An ambulance operations manager is the guy who ensures all the ambulances are up and running, the pilots are rostered, the fleet is serviced, the repairs are done. So we make sure that fleet, which needs to reach in 10 minutes, is available for everybody. And then on top of that, we have a couple of more layers. One is the training officer, the academic officer that we have, the role which I play with Redversity. So if you want training, you want to do training, go ahead, become a simulation-based instructor. Redversity has branches across India. We'd be more than happy to take you as one of our branch heads and then, build a career for you. And then, of course, there's the business arm of it. You get into the business side, talk to hospitals, maintain relationships with them, figure out how they want their ambulances run. You want the ambulances to run for them. You can make strategic decisions on growth and say, okay, I'm the chief business officer. Yes, I will lead it. I will become your CEO in the future, right? So all of these are available, and these are pathways that exist at Red Health today. So don't worry about career growth. It's established paths for you. All you have to decide is, yes, I want to be the next superstar of the hospital care in India.
Great. So you told me the initial package is at 6 lakhs. And as I always tell everyone, the final number depends on how good you are. How are you willing to learn and keep on applying yourself? I just want to know what the basic course fee is for the course.
Oh, so the basic course fee for this is 3 lakhs, which the students can pay in up to 3 installments. The university has been kind to them. They say, okay, you can pay it in 3 installments. If some of them feel, hey, this is a little on the higher side for my pocket right now, there's also a student loan that they are providing via ICICI Bank, and that's an established system as well. So you don't really have to worry about the funding. So you can pay the fees. It's 3 lakhs in 3 installments or through a student loan. You get 6 lakhs at the moment you finish per annum, of course. But if you really start performing well, you're going to get a quick return on investment because you're going to get incentives, you're going to get your variables. So based on the work that you're doing, you should be able to work this off very quickly in probably about 6 to 8 months. And then everything else is your earning is what I would assume.
Great. Oh, that makes absolutely sense. So this is a course which basically has scope, which is in demand now, which is growing in India, which is required in India basically, and I'm going to earn more in a year than I actually invest for the course. So it seems to be basically a no-brainer. But what if I do this course?
Yeah.
Sorry, I cut you off.
But tell on. So I was just saying, look at the alternative. You have a 2-year management program, you pay 20 lakhs for it, you don't know what you're going to get employed for. When's the ROI happening? Ta-da! So you're making it as sweet as possible for you to do this course. Please go on. I'm sorry I interrupt you.
Yeah, that's no problem. My point is now, if my aim is not to stay in India in the long run, we like it or not, there are few people who want to go abroad, better lifestyle, better, it's different reasons for different people. So is there career growth and scope if I plan to shift internationally, maybe after 2 years, 3 years, 5 years? What's your take on that?
Absolutely. See, I told you that this course currently exists only in the developed EMS systems in the world, right? Which means they know the value of this course, be it the US, be it the UK, be it Stanford again is in the US, but they all know the value of this course, and that is why they are doing this course. But when you look away from all of these globally well-developed countries who know the value of pre-hospital care academics, who needs these leaders, right? The Middle East. So you have Dubai, Qatar, actually having great developed pre-hospital care systems. A lot of Indians are working, Hamad or National Ambulance. You have Japan, South Korea, you have Singapore. who wants all of these professionals there. And then you have developing EMS systems, which is entire Southeast Asia, the rest of the Middle East, which wants you. So all of them want great pre-hospital care professionals. And if you're thinking, oh, is my degree going to be valid? Let me tell you, any degree that you do in India is valid in India. When you go to that country, you have to write a professional exam for that country. And that is their validating exam, not the degree that you got from any university. And then what you're supposed to do is show your degree from the university saying, hey, this is my degree. They will take it as a certificate of training and then they'll look at the experience you have. So if you really want to work abroad, after completing this course, you have to ensure that everything that you do in the next 1 or 2 years, you do with a logbook. You maintain a log. You maintain a career, a repository or record of everything that you do, so that when you go and stand there, while you write their licensing exam, you show your certificate, you also show a log of all the work that you have done. Nobody can deny your job. Okay. And if you add one publication to it, wow, that's in Hindi we say "Sone pe suhaga." So that's how that will work out. So abroad needs spiritual care professionals. They consistently look to India because they feel good educated talent comes from India. That's the brain drain that India suffers from. But on the upside is that all of these people going abroad are getting paid very highly. If you look at CEOs of all the top companies in the world, you will find a lot of Indians there. So Indian talent is highly welcome in many countries, and pre-hospital care is the next big development happening in healthcare. So obviously, you don't have to worry about it.
Understood. This idea you told about logbook absolutely makes sense. I've seen a lot of people skip this step. Okay. So when you get into this field, you should have a LinkedIn profile where you post things about your growing in the career. So for people who are even planning to do this course or shifting into non-clinical, take this advice from Dr. Tausif. Create a database of what you're doing as you're growing, because that would enable you when the time comes to show the people is this is what I've done over the years, and on this basis could I get a job. Very good advice out there, Dr. Tausif. Uh, is there any reason why do you feel dentists should make this shift?
Are you kidding me? Like I just said, dentists are running half of India's healthcare right now. Okay. And I'll tell you why. Why, right? I mean, of course, a dentist, if he or she pursues a clinical bent of mind in a career, yes, they can make a fantastic career of dentistry. But there are a lot of dentists who say, hey, let me try something else. Let me look at non clinical things. Let me look at something out of my comfort zone and figure life out in that direction. And then a lot of them get into administration or management or teaching training and quality. And if you take the best hospitals across India and you look at their quality heads, rest assured, a lot of them will be dentists. Okay. If you look at their operations head, rest assured, a lot of them will be dentists. Why? Because dentists have this unique mix. So while they can understand these management and operational systems, they also carry clinical background. Or when somebody with a clinical or a healthcare background comes in and says, hey, I will lead your administrative aspect as well, they tend to understand things faster, better, and are more patient centric. When a non healthcare person takes up these management forces, they are not so much patient centric, more number centric, and becomes a pain point on deciding not that they don't have the best interest of the patients in mind, but they just don't know who requires more gloves and who will require less. Where I need to put extra sterilium or extra cleaning protocols and where I need to put less, right? So that efficiency metric, a dentist, when they are leading healthcare verticals, can bring in beautifully, and the blend is excellent.
Now, I'm sure the audience has got a complete idea about the source. And if they are interested, how do they go about joining the course?
Okay. You have to do admissions at redversity.com is where you need to send an email. You can visit our website. The website is also the same, www.redversity.com. And I'm sure you'll find out these details. Somebody will definitely respond to you immediately when you send the email because we're super passionate about it. And we want to quickly gauge the interest that you have and encourage you to do the course. So please do. And I'm sure they will also then, once you send the mail, they will also say, give you a person's number who will become your liaison, and you can have conversations with them. You can visit our office either in Bangalore or in Hyderabad, whichever city is up for your liking, and have a counseling session if that also helps you in that manner.
Great. It's really nice knowing you, Dr. Tausif, and seeing with what you have done over the years, the field you're passionate about, and you're trying to grow it. And for people who are planning to make a shift from clinical dentistry into another option. The advantage of EMS is it's a growing field, number one. Number two, there is demand in both India and abroad. Number three, currently there is a job guarantee that you would earn more in the year after you finish the course than you actually invest in the course. Number four, you can do majority of the textbook learning sitting at home from the comfort of where you are, and go there and learn the clinical skills and the hands-on skills what you require from there. So this dual advantage of being learning clinical skills and hands-on when required, as well as learning the textbook stuff, things which you can learn from home, from the your comfort of your home, is another added advantage. So if you are seriously interested, as Dr. Tausif has already told, shoot them an email, and based on their passion, I'm sure about it, they'll quickly contact you and try to get you on board. So I guess there are a few questions here for the people who are still watching. What is the cost of the course? We have already answered it. It would cost you around 3 lakhs, and your initial uh, guaranteed pay is around 6 lakhs. From Pakistan, if you can join this course, hopefully they will start something up like this in Pakistan, but currently this is only for India.
I can't. So they have to. Sorry, I'm sorry. I'm back. I
Yeah,
thought you were asking me the questions, right? Sorry, I just
yeah.
came back. I realized there was something there. Okay, so I'm just saying. So Pakistani students, can they come and study in India? Well, you have to get permission from the Indian government. Okay. When you do your 3 month plus 2 month course here, you'll have to come here, and I think every week or every day or something, you'll have to go to the local police station and sign. That's the current requirement for all Pakistani students, but only if you get a valid visa and you're allowed to come and do the course here. That's how that works. So, yes, you can if you want to, but you'll have to deal with a lot of the government regulations, which may make life a little tough for you. But yeah, if you want to, sure, why not? If you're passionate enough, you can go back and build this in Pakistan.
Great. That's the entrepreneurial mindset, right? That we will collaborate and try and grow everyone together. It's a very nice mindset.
Absolutely.
The next question was, I can't do this course right now. Can I do it next year? What I would suggest is trying and contacting the university now. Okay, taking the details. There are mentors out there who will keep data of all the people who are connected with them, so that when they have the next batch, I think the next batch would be in 6 months mostly. So whenever they have the next batch, they'll be easily able to contact you. Otherwise, what happens if you do not contact them right now? You would forget it, they will not remember you, and then things just go off track. So try contacting them now and getting into their database. When is this course starting?
Right. We're planning to start this course in September. That's our goal at this point of time. It gives us enough time to talk to people about it, get enough interested aspirants into the course, and then make sure we start off with a bang and do it. Of course, this is in discussion with the university. They're the ones who've thought that that's the right timeline for us to start. Applications have already opened. I suggest that whoever is interested fill in these applications fast, because I'm sure they will. Because if we have to start the course in September, we'll have to close the applications quickly, right? So I'm sure in a few weeks they'll close the applications as well. So those of you who are interested, please go ahead. The IHMR operates a tight ship, and they would like to get all their administrative processes in place before they start the course. So September is what you need to look forward to for the course.
Great. I think rest of all the questions have already been answered. And those who are really interested, remember, email Redversity and they will get back to you. Thank you, Dr. Tosser, for your time and answering all these questions out here. Thanks a lot.
Yeah, thank you, Dr. Satish. A pleasure. Take care. God bless.
If you like this video, do not forget to check out our entire playlist on non-clinical options after BDS.